Your doctor told you there's nothing that can be done about your neuropathy. What if your doctor never ran one test that would prove them wrong? So you went home with that answer. Maybe you even accepted it because the doctor told you this, but the numbness kept spreading. The tingling woke you up at night. You started to watch how you walk because you can't fully feel the floor anymore. You're not being dramatic. You're living inside a situation where someone handed you a surrender note and called it a diagnosis. There's a test that directly measures the density of the small fiber nerves in your feet. Most doctors treating neuropathy have never ordered it. What that test shows about your nerves and what it means for your future, that's what this video is about. We're going to walk through what your doctor got wrong, why they got it wrong, how to know if this really applies to you, and what a real workup and a real treatment plan actually looks like. Your doctor said nothing can be done because they never learned about the test that changes everything. The standard answer for peripheral neuropathy for decades has been this: nerves don't heal, damage is permanent, manage your symptoms, don't expect it to get better. That's what most primary care doctors believe. That's what most nurse practitioners believe and are telling patients every single day. It spreads because for a long time, the tools to measure small fiber nerve density with precision didn't exist in general practice. The testing wasn't taught, so the thinking defaulted to, we can't see it clearly, we can't fix what we can't measure, so nothing can be done. The flaw is that medicine has moved forward, and the message to patients didn't move with it. Small fiber nerve density testing exists. It's objective. It gives you a number. It tells you how much nerve density you've lost, and it gives you a baseline to measure against as you treat. Saying nothing can be done in 2026 while this test exists isn't careful medicine, it's outdated medicine. Most people are suffering through pain and numbness and tingling in their feet every single day because the doctor they trusted told them this was permanent. Some of those people have fallen. Some of those falls have put them in the hospital. Some of those hospitalizations led to surgeries, long recoveries, loss of independence that didn't have to happen. The problem isn't that neuropathy is untreatable. The problem is that most people making that call aren't using the tools that would prove them wrong. When you do a proper history and physical, and when you add advanced testing, including small fiber nerve density testing, you can actually see the loss. And then you build a treatment plan from real data. You can drive nerve density back up over time. That's not a theory. That's an objective, measurable outcome. I've had patients come in carrying a long-standing diagnosis of permanent neuropathy. After testing, we had a real picture of exactly what was happening. After treatment, that picture changed. The numbers moved up. The symptoms improved. The nerve density went up. When nerve density improves, you get protective sensation back. Your brain starts to receive real signals from your feet again. You're less likely to fall. You're less likely to miss an injury that turns into an infection. You're less likely to end up on a path where someone's talking about amputation. In a moment, I'm going to tell you exactly what most neuropathy workups are missing and why that gap is the reason so many people are being told to give up. The standard neuropathy workup misses that nerves are actually causing your pain. The standard neuropathy workup looks something like this: a conversation about symptoms, maybe a monofilament test where someone touches the bottom of your feet with a small wire, maybe a nerve conduction. You get a category: diabetic neuropathy, peripheral neuropathy. Then a treatment plan is built around medicines to blunt the symptoms. Symptoms-based medicine is faster. It fits into a 15-minute appointment. A monofilament test takes about 2 minutes. A nerve conduction study is more involved. It measures the large fibers nerves, the ones responsible for motor control and major sensation. It doesn't measure the small fiber nerves, and those are the ones most responsible for the pain, the tingling, the burning, and the numbness. That's what neuropathic patients actually live with. If you test for the wrong thing, you'll miss the real problem. A nerve conduction study comes back normal, while your small fiber nerve density is significantly compromised. The normal results gets handed to you as reassurance, and you leave thinking you've been thoroughly evaluated. You haven't. There's a specific feeling neuropathic patients describe. It almost never makes it into the clinical notes. It's a feeling like bunched up socks under your toes, even when your foot is bare. It feels like walking on sand or gravel or on a flat surface. It feels like low electrical currents that won't shut off. These aren't vague complaints. These are signals from your smaller fiber nerves, and the test that captures them is the one that most doctors never order. The test exists. Small fiber nerve density gives a direct, objective count of the nerve fibers in the skin of your foot. Not an estimate, not a clinical impression, a number. And that number tells you exactly what you're working with. A complete neuropathic workup includes history, physical, standard testing, advanced testing. It looks at blood flow. It looks at structural condition. It considers whether the problem is purely diabetic or whether there are other contributors. Then it builds a treatment plan around the actual picture, not the assumed one. The approach I use is built around getting the diagnosis right the first time, not guessing, not assuming, testing, because when you know what you're actually dealing with, you can design a treatment plan that works for that specific patient, not a generic plan for a category. When the workup is complete, the treatment is specific. And when the treatment is specific, the outcomes are real. Symptoms improve, nerve densities improve. The patients that were told they had permanent conditions start to experience something they were told wasn't possible, getting better. If you want to know whether any of this applies to you, stay with me, because the next part is going to help you recognize your own situation in this. If this is already changing how you think about what you've been told, do me a favor and subscribe before we keep going on. We put out videos specific to people dealing with complex foot and ankle condition who aren't getting the answer they need from standard medicine. Subscribe so you'll see the next one. 5 questions that'll tell you if you've been given a real diagnosis or just a knowledge gap. Most people watching a video like this have some version of the same story. The symptoms started, they went to a doctor. They were evaluated in some form. They were given a diagnosis and a medicine and a message that this was now their life. And somewhere in the back of their mind, there was always been a question. They weren't sure they were allowed to ask. The pattern looks like this. You were given a diagnosis with neuropathy, diabetic or otherwise. You were told management was the goal. You've been on medicine for the symptoms, possibly for years. The symptoms haven't significantly improved. No one's mentioned testing your actual nerve density. No one talked about building a treatment plan designed to reverse the underlying damage. Ask yourself these. Has anyone ever done a small fiber nerve density test on your feet? Has anyone ever looked at your blood flow as part of your neuropathy evaluation? Do you have a treatment plan with a measurable goal, or you just have a prescription to manage symptoms? Has anyone told you that nerve density can be driven back up with the right intervention? Has anyone talked to you about fall risk you're living with right now? If the answer to most of these questions is no, you have not been given a complete evaluation. You've had a standard one. And standard in this case means incomplete. Now let's talk about what you actually do with that information. Why symptom management isn't treatment, and what actually reverses nerve damage. There's a difference between treating what you feel and treating what is actually happening. Medicine that dulls the pain isn't treating neuropathy, it's treating your awareness of neuropathy. The nerve damage continues, the density continues to decline, and the risks that are coming from not being able to feel your feet, the falls, the missed injuries, the infections, keep growing. The treatment protocols that actually move nerve densities aren't experimental. They exist, they're being used, and the patient who goes through them comes out on the other side with objective evidence of improvement. A number that was low goes up. Symptoms that were constant becomes manageable, then minimal, then in some cases, gone. Stop accepting nothing can be done without asking what testing was done to reach that conclusion. Stop treating symptom management as the goal when the actual goal is nerve recovery. Stop waiting for the symptoms to become severe enough that the doctor will finally take them serious. The earlier a real workup happens, the more there is to work with. Start asking specific questions. Ask whether a small fiber nerve density test has been done, or is it appropriate for your case? Ask what your treatment plan is designed to accomplish besides symptom control. Ask whether there are contributing factors that have been evaluated. Blood flow, structural conditions, systemic issues. If a doctor can't answer these questions or tells you that your questions don't matter, that's a signal worth listening to. Advocate for yourself. That's appropriate. If you've been living with neuropathy symptoms for months or years and nobody ordered a small fiber nerve density test, you're not asking too much by wanting to know why. And if you want something concrete to do tonight, that's exactly what the last part of this is about. The one thing you can do tonight that will change your next doctor's appointment. Most patients don't know the difference between the tests they've had and the tests that exist. They trust that the workup was complete because a doctor ordered it. But there's a real and significant difference between monofilament tests and small fiber nerve density tests. Knowing differences puts you in a completely different position when you walk into the doctor's office. If you took a photo in the dark and the photo came out black, you would conclude that there was nothing in the room. You would conclude the photo didn't capture it. A nerve conduction study that comes back normal isn't proof that your small fiber nerves are healthy. It's proof that the large fiber nerves it was designed to measure came back normal. The room still has things in it. You just need a better light. When you know what was tested and what wasn't, you can ask for the right test. And when you have the right test, you have a real baseline. And when you have a real baseline, you can have a real conversation about treatment. That's how patients who were told nothing could be done start to get better. Here's what to do tonight. Write down every test you've had for neuropathy. If you don't remember the names, write down what was done during the appointment, what they touched, what machines were used, what results were given to you. Write down the names of the diagnosis you were given and whether it came with a measurable goal, a number to improve, or only a prescription. Write down one question you've never asked your doctor about neuropathy, the one you assumed was pointless to ask. Bring that list to your next appointment or bring it to a second opinion. Walk in as someone who's done work to understand their own case, because that patient gets a completely different conversation than the one who nods and accepts the answer. You have the right to know what was tested and what wasn't tested, and what your options actually are. That's basic medicine done right. Peripheral neuropathy isn't automatically permanent. For too many patients, it's permanent only because the right test was never ordered and the right treatment was never built. The small fiber nerve density test exists. The treatment protocol that moves the number exists. Getting better from something you were told was untreatable is possible. And for a significant number of patients, it's what actually happens. If this video landed for you, go watch the one before it. It covers something that happens to neuropathic patients who's been left without answers for too long. A doctor recommends amputation without doing the full workup. This video is called Before You Agree to a Foot or Toe Amputation, Watch This. It's linked right here. Watch it before you make any major decisions about your foot and ankle care.